Well, I'm glad to be with you tonight discussing a topic that's near and dear to my heart because my mother, who is now deceased, dealt with depression for years. She was on Elavil, and that was an antidepressant. I think it's an MOI inhibitor. She was only supposed to be on it for a few months and ended up being on it for 25 years. And it started just after I was born. So I guess she was she was depressed, looking at me thinking, "Oh my heavens, what have I done?" Anyway, I'll give goofing aside. It was difficult, and I think depression is misunderstood by many people, and oftentimes we're judged when we're depressed, and we all have depression. Clinical depression, maybe not, but I'm going to suggest that clinical depression is just a name that we give it, but I think it's still various emotions or various layers of past trauma that's happened to us that drops our endocrine system. Now, we might have it passed genetically to us, so we have a predisposition towards it, but I think over time, as we have these different issues and stressors in our life, it causes us to great burnout in that endocrine system, so we're not having enough adrenaline, enough neurotransmitters, and those neurotransmitters will diminish over time as we are living in the sympathetic, uptight fight or flight mode constantly. So it's a definite issue. But this is me. I'm Troy Giles. I'm a doctor of chiropractic, and I've worked now for 23 years coaching my own patients and coaching other doctors how to create wellness centers. So I'm glad to be with you tonight. This is serious, though. It's a common but serious illness. It's overloaded with stress, like I was mentioning before, and you just feel so backed into a corner that you can't even think about looking up. It's usually described as a condition with feelings of severe despondency and dejection. Just so you just don't even care anymore. It's complicated by feelings of inadequacy and guilt. If you're not feeling adequate to handle, guess what? None of us feel adequate to handle anything. We have to just keep getting up and pulling our bootstraps up and going. But when you get to this intensity, when it turns into depression and severe, this sense, you can't even begin to even think about pulling your bootstraps up. But then you feel guilt because your children aren't being fed, and you're not being as good of a mother or father or a boyfriend or a friend. There's physical effects include lack of energy, disturbance of appetite, and sleep. So the actual etymology or the name, basic origin, is Latin, deprimere, or to press down. And that's one of the pictures is that sense of just overwhelm it's being pushed down out of us. Depression is a condition that's heavily marketed by the pharmaceutical companies in partnership with the medical industry and mass media. Basically, I love the commercial. It says, "What is the purple pill right for you? Ask your doctor, is the purple pill right for me?" Goodness sakes. It's not a matter of taking a pill to have joy or peace or calm or bliss. I'm not saying that the antidepressants don't lift you up, and I know so many patients who are antidepressants or anti-anxieties, and there is definitely a reason, and if we'll address that reason, if we'll look at the 6 essentials of life, Dr. Mortar, with the best technique that I learned early on in my practice, suggests the 6 essentials of life: what you eat and drink, exercise and rest, breathe and think. Those are the 6 essentials, and when we pay attention to those, when we discuss those with our patients and help them go through those 6 essentials, that's the basis. And then we just look at the basic triangle of health that I discuss in my practice. Structure, as a chiropractor, I work with making sure that the structure is well, that the conduit to the spine and to the organs is set. The other side of the triangle is emotion. We'll talk about a little bit of working on emotion tonight. And then the other part is physiology. What can we do to supplement them? How can we support their endocrine system? What can we do to support their hypothalamic, pituitary, adrenal axis that is the baseline of their endocrine system? So the drug companies, they want to basically advertise to increase their bottom line. Every dollar spent in advertising prescription drugs is estimated to increase their sales by 4.2 or $4.20 because consumers are asking their doctors for these drugs by name. Is a purple pill right for me? So this is something you should be familiar with. This is a good list of the antidepressants that are there. Know what they do. Know their side effects because many of your patients are on them. And you've seen these. You've seen Cymbalta. You've seen Zoloft, Paxil, Prozac. Anyway, get an idea of what they look like and what they do. The common side effects of these SSRIs or MAOI. This, I believe that Elavil was an MAOI. They cause a wide range of effects, including nausea, insomnia, dizziness, hostility, sweating, dry mouth, diarrhea, headaches. But some of the effects go away after the first few weeks, and others will persist and may get worse. Be aware of the dangers of stopping abruptly. A lot of people say, well, I'm just going to stop. I don't care what my doctor said. I just want to get off of them. And that's dangerous. Whether they want to go back to their medical doctor or not, I encourage them to, so that they can tell their doctor, I want to come down. I want to get off of it. If that's their desire, then how do we step that down? Little by little, how do we titrate off of it? Is it going to be a 6-week process, a 2-month process? So antidepressants, we call it an antidepressant discontinuation syndrome, where if they stop it too quickly, it'll just send them into a major endocrine system malfunction, and it can really be dangerous. So we want to make sure they come off slowly. So depression as a national debate, a lot of it's happening now. We've got the violence concept. A lot of people are showing tendencies to shooting and all the psychiatric issues. So are mood disorders causing gun violence is a question that's out there. Is that what's happening? Well, basically anybody who's going to walk into a school and start shooting people definitely has a mood disorder. No question. Can psychiatric diagnosis predict these disasters? Possibly. Definitely we need to support our patients and help them through what's been etched into their mind with past issues, which we will discuss in a minute. Are shootings the deranged acts of mentally ill? And can gun control prevent more shootings? This is what's happening nationally. So according to 2%, or 2 recent Gallup polls, 80% of the population believes that mental illness is at least partially to blame for such incidents. Well, it's 100%, in my opinion. It's not just, it's 100%. They've got to be deranged in order to do what they're doing. One of my most favorite actors, and a brilliant, brilliant man, and it was sad to have him die and take his own life, but this is how bad it gets. So he said, I used to think the worst thing in life was to end up all alone. It's not. The worst thing in life is to end up with people that make you feel alone. And think about Hollywood and all the stress that he went through in his life. But think about that when our parents, for example, don't pay attention to us as a younger age. That we do feel alone. But I think if we can educate and have a more national awareness of letting go of past emotions, letting go of past issues, do that through forgiveness is the biggest way that I do in my office that works so well. Nothing is stronger than forgiveness, and we'll discuss that. So there's different kinds of depression, and I like this black hole look. It's to sense like everything is being drawn out of you. So the different kinds of depression is the major depression, persistent depressive disorder, psychiatric depression, postpartum depression is very common, seasonal affective disorder. We've got I have a video on my YouTube channel that discusses seasonal affective disorder. Oftentimes vitamin D is associated here, not having enough vitamin D from the sun, because our sun's in the southern hemisphere if you're in the United States. Bipolar disorders. That can be, again, from malfunctioning endocrine system. So the ups and downs of that, of the stress, where we're up high and then we go into a depressive order. And that can happen cyclically over months, over weeks, but bipolar is very common. And then some mood disorders can also cause depression symptoms. So just ADD and ADHD can ultimately lead into depression. Some mood disorders can also cause depression symptoms. So, for example, ADD and ADHD, it's difficult. I have that. I have ADD and ADHD. I don't know if it's intense, but I'm always going. And it can lead to physical depression, where you're just so tired, which leads then to mental depression. So according to the National Institute of Mental Health, 7% of the adult U.S. population has major depression. 7%. That's an intense amount. So I like this picture here, where life just seems to be pushing down, and every one of us has an issue. I go up and down the street in my mind of my neighborhood, and I can tell you in each house what's going on as far as the amount that I know of, and every one of us has an issue. A child that's stressed, or that they might have lost a job, or whatever. We all have that life factors on us that help us to become stronger. Either life's going to kill you or it's going to make you stronger. Isn't that one of, I can't remember what her name is who sings that song, but that's very common. So for major depression, you may experience a sad or depressed mood or an inability to feel pleasure, plus 5 or more of the following symptoms for at least a 2-week period. This is how medical doctors describe or diagnose. Feelings of guilt, worthlessness, helplessness, and hopelessness. A loss of interest or pleasure in usual activities, including sex. And sex is, according to Maslow, I don't know if you've studied Maslow's hierarchy of triangle or a pyramid of importance, but they found that in Auschwitz or in the concentration camps, here you would have men and women together going to the gas chamber. Of course, they were scared to death, but there was no sexual at all, and many times men and women were nude by each other, and there was no sexual arousal, because sex is at the top of that pyramid. First you have to have shelter and food and water, and that's at the base of the pyramid, and then at the very top would be self-actualization and sexual behavior. So it's very common that sex diminishes. Difficulty concentrating and complaints of poor memory, insomnia or oversleeping, and sleeping just because you don't want to deal with it. So you just go basically into a la-la land of sleep, of not wanting to pay attention to life. Your appetite changes, which may include weight gain or loss, fatigue, lack of energy, thoughts of suicide or death, slow speech, slow movements. And this is just what happens when you start to think about your endocrine system dropping. All of that is endocrine. I can point right back to all of that as part of your endocrine system. So the treatments that can usually be divided into 3 different categories: your brain function, endocrine function, and emotional. So we'll kind of discuss how that works. But the first part of the concept, and I would recommend this book, Change Your Brain, Change Your Body. And this is Dr. Amen, Daniel G. Amen. He's a medical doctor and has done a tremendous job at discussing how food and things make a difference in your brain. But I use this 60-question questionnaire that's found in this book that helps determine what part of the brain is low functioning or malfunctioning. So within that 60 questions, each 10 questions represents a certain part of the brain. So the prefrontal cortex, the amygdala, the central gyrus, it discusses each one of those. So you give this 60-question questionnaire to your patients, and then it'll tell you, you add the ratings up. So let's say that question number 1 you give a 5. It's very, very intense. Question 2 you give a 3. So you add up the numbers representing each of those questions, and the area that has the highest number is the area that you need to focus on first. But sometimes you might focus on 1 or 2 sections. So for example, you would give them maybe tryptophan or serotonin or SAMe. These are things that you would give to that particular part of the brain, according to what Dr. Amen has found. And I really appreciate him for this work. So I would encourage this book for sure on working in brain function. Next then would be the endocrine system, and this is where I really play a lot in my practice. Most patients I see with depression have sluggish adrenal glands and are just at the end of their ropes. So adrenal burnout, then leading usually then to thyroid function malfunction, pituitary fatigue, and then hypothalamitis. So that's kind of upside down of how it flows in the body. Really what happens is the hypothalamus is part of the brain that it controls the pituitary function. It's in direct control. So pituitary is the gatekeeper. It's the master gatekeeper of hormones back and forth. So the pituitary will stimulate thyroid with thyroid stimulating hormone, and then thyroid, once it gets enough, sends a signal back to the pituitary, and the pituitary slows down its production of, or it's the stimulation of thyroid stimulating hormone. Same thing with the adrenals, same thing with all different functions of the endocrine system. So the pituitary opens and closes the gate but the hypothalamus is the boss of the pituitary. But when I'm looking at people, most generally speaking, they have at least adrenal burnout. Now, we'll discuss how you determine adrenal burnout in an exam here in a minute. But the adrenal gland is like your pawn in a chess game. It's the first line of defense towards stress. So your adrenal glands burn out all the time, and then that creates hyperadrenalism, where you're having too much adrenal output all the time. Even though you're burnt out, it will shoot up your adrenaline also with your insulin. It's kind of a sugar balance issue. So we work with adrenal glands, thyroid, pituitary, and hypothalamitis. And one of our new supplements that just came out with Inno-Vita is called Zenadapt, and we'll discuss that in a minute. That's going to work with the hypothalamic pituitary adrenal axis. So most patients I see with depression have sluggish adrenal glands and are just at the end of their rope. I really like this. One last strand and it's going to break. But the idea is to get them back a few more strands until finally that rope can be mended. And then recognizing emotional symptoms are not as easy as they vary from person to person. But this is really where I feel most of the depression happens. It's usually not an issue that's right in front of you. It's a layering of past emotions. So I discuss with patients, it's like each of these past experiences are almost like a post-traumatic stress syndrome, PTSD, where each of those would be like a rock that you would be carrying around in a backpack. Well, over time, that backpack gets filled. And now we go and we're saying, okay, now we're going to go climb Mount Everest with this backpack of rock. Well, that's not going to happen. We've got to get rid of the rock first. So these past experiences have emotional tied to them. Those emotions are what cause autonomic nervous malfunction. So the autonomic nervous system is what is happening automatically. The autonomic nervous system it's what makes your eyes dilate, your heartbeat, your calcium, magnesium, potassium, all of those things that you don't know. If I walked up to you and said, "What's your calcium right now?" You can't tell me. That's part of the autonomic nervous function. That is what is affected most by conscious and subconscious emotions. So by recognizing that there are emotions in your past, writing them down on a page, and helping them to forgive, that's what it's about. So the autonomic nervous malfunction is just so important, and we'll discuss how to treat that as we go. The techniques that are out there you might have heard of, one of them is NET, or neuro-emotional technique. This helps to let go of stuck mind-body stress patterns. BEST, I mentioned that earlier, was done by M.T. Morter, who has now passed away, but his family continues it. This stands for Bioenergy Synchronization Technique. And this helps to remove interferences caused by imbalances, mostly emotional. And then craniosacral is a chiropractic technique that's taught to chiropractors and massage therapists and others. This is relieving pain and tension, especially with the central nervous system. But these are just a few of the concepts that you can use. But I would like to tell you a quick way that I do when I'm working with emotions. You can have your patient make a list of past issues. So I'll have them across the top of a piece of paper. On the left side, I'll write did. In the middle, didn't do. And on the right side, was done to me. So these are past things that they can remember. Now they will write one word in each of these lists representing each of the things they can remember that they did. That would be on the left side. So they might have 10 words under did. These words are representing past situations that they did. So let's say, for example, they almost went too far with a boy when they were in high school. Well, you wouldn't want them to put make out on the paper. You would want them to put the boy's name, like Joe. Because you as a practitioner, when you see this page, you don't want to judge the patient. So if you see Joe, don't know what that means. But you can step them through a forgiveness process of first forgiving themselves, secondly forgiving the other person involved, like Joe, And thirdly, allowing others who they have affected, since what they did in high school, so you can allow others to forgive them, people that they have affected by what happened when they were younger. And they might not remember who they've affected, but it doesn't matter. It's all a neat process. So what I'm going to do is I'm going to shoot a video, and I'm going to put it on my YouTube channel, and it'll be on YouTube and under Troy Giles, and so it should be up anytime. You can look under Troy Giles, and let's put it under how to treat emotional disorders. That'll be the name of it. And I'm going to show you how we do this process of forgiveness and how we do a real easy step to remove those emotional rocks out of the backpack. And there you'll be able to see a better explanation of how to do that. Likewise, I'll write this up and give this to Inno-Vita as well, and they will be able to, you can call Inno-Vita for a copy of how to get this done. And I will put this on my list of things to get done this week. Very nice. So let's move on now to the different formulas that we're going to discuss. We discussed earlier Zen-Adapt. So this is an adaptogen. There are adaptogenic herbs that are within this that help to balance that hypothalamic pituitary adrenal axis. So stabilizing adaptogens to cope with endogenous and physical stress. So this is a tremendous, love this product. It really helps people to balance in the endocrine system. Adrenex supports the adrenal glands and raises energy. Raising energy is a first priority when you're dealing with depression. Next, thyroidin. This is a balanced thyroid and increases metabolism. So this kind of helps the body increase their metabolism. And I kind of use the idea of when people are sick, they're kind of swampy, if you will. And this helps to raise their metabolism so they become a faster river versus a swampy, slow-running air thing. So when you think about depression, it's very slow. It's very, very, very low energy. So we want to increase that through the thyroid. Next is pituitin, and this is the endocrine support as the priority gland is a main control, and it's the main control center of the body, the main gatekeeper. So pituitin stabilizes that process. And then hypothalamus supports the hypothalamus and balances the nervous system. So Zen-Adapt is adaptogens that work with the pituitary, adrenal, and the pituitary, adrenal, hypothalamus. So hypothala itself is supporting the tissue, where Zen-Adapt is more supporting the overall endocrine system and helping you to adapt and actually find Zen, if you will. That Zen is that balance. Okay, serologic supports the brain function and creates new pathways of thought. So many times we have to fill in the slippery slide of thought. They run down the same slippery slide, so they people who are depressed constantly are going into that same mode of thought. So we want to fill that slippery slide in with cement, heal it, and then create new pathways, new ideas of thought, new mannerisms, new thought patterns. Serologic is very effective at that. Sedaquil creates a sense of tranquility and sedating overall, and it works with calming down the nerves. So that's Sedaquil. Nerval supports nerve tissue. It can help to work with neurotransmission. It can help to replace and support overall nerve cells, so that ultimately you can even affect the myelin sheaths of the nerves. So I'll use this with people with MS or car accidents that are trying to regenerate nerve tissue. That's all very important. And then lastly is the IntegraCell. This is the strongest super antioxidant that I know of on the market. This particular supplement per scoop has 8,000 milligrams of type A antioxidant. So there's type A and type B. Type A will knock out 1,000,000 free radicals per molecule or milligram. A type B will knock out 1 per 1. So 1 milligram will knock out 1 free radical. So if you think of this, 8,000 milligrams times 1,000,000 is 80 billion free radicals that this will get rid of. That's just amazing to me. So this is, I really feel, one of the most important. Basically I give everybody IntegraCell as I start with them, because it's going to help get rid of toxins. It's going to help just relieve the stress and pressure so that we're creating an environment for healing. Now, also, I always discuss layers of infection. So many times patients who are depressed will have various layers of infection drawing energy. So depression can result from a body that is overstressed and fighting layers of infection. So always test for these infections. So bacteria, that's Bacto-X. Meta-X is metals and heavy metals and chemicals. Microcyte is for microparasite. This is one-celled organisms. These would be amoebas, flagellates, things that you have to see with a microscope. Paramac would be larger, that you could see with like the tip of a needle or a pinhead, things that you can see with your naked eye, all the way out to a tapeworm. And while we're here, microcyte we treat for 40 days constant. So let's say you're going to do kinesiology and muscle testing and determine how much to give the patient. So we're going to give them 2 a day, 2 capsules a day, 1 in the morning, 1 in the evening, and you would then do that for 40 days minimum. Paramac is different. These types of parasites lay larvae, and the larvae have to be hatched. So we treat the patient for 10 days on, and then a 5-day rest period where the larvae will hatch. Then you treat it again, and you do that for 4 cycles, or 2-month process. So each cycle is 15 days, 10 days on, 5 off. The 5 off allows the larvae to hatch, and then you kill them. Once they've hatched, you then reintroduce the Paramac, and it will kill then those that have hatched. To make sure there's no more larval hatchings, you do that 4 cycles. Fungex is awesome because it stops fungus from propagating, from creating new fungus, new spores. So the fungus actually die of old age. So this is good for fungus, mold, yeast, all of those fungal spore type issues. So I'm getting a lot of patients with fungus just because of antibiotic therapy. Those also with black mold in their homes, we find a lot of this, people calling in and wanting to know more how to treat symptoms of black mold from their homes. And then lastly is the Virox, and this works with viruses. Lately, and as you start into the cold and flu season, when somebody comes in with snot and cough, I just always give them Bacto-X and Virox, along with Tox-X. Tox-X is a chelating agent, and this will help to get rid of toxins. It basically brings the toxins together and chelates them into larger molecules. So that's why I put, so that this diminishes the amount of Herxheimer's reaction, where you're herxing, they call it, when you're starting to that healing crisis. So an average when I use Bacto-X or Virox, I usually do when they're sick with a bad cough and sore throat and just, you know, they've got, I'm not sure if it's a virus or bacteria, so I'll go Bacto-X 2 a day in the morning, or 2 in the morning, 2 at dinner time, and then I'll go 2 Virox at lunch and 2 Virox at bedtime. So it's kind of leapfrogging and helping the body to have a chance to focus on that one type of issue. You can also do it together, 1 of each 4 times a day. That also works fine. Okay, so treatment protocols. Again, you always want to do kinesiology or muscle testing to determine what your patient's most effective is. You know, you want to tell them, because it's not always just about how much they weigh, it's what they can handle. But 1 capsule 4 times a day for Zenadapt, Serologic, Nerval, and Fungex as well. And then we want to reestablish the flora with some of our new supplements. The reestablishing the flora, we use Fluorescin and Vivaprofen, which are here. So Fluorescin is effective at reestablishing, and it's just straight out good bacteria, where Vivaprofen is good bacteria plus helps to shut down any inflammation in the gut. So I find that there's always going to be an inflammatory state when we're working with a layer of infection in the gut as well. And then Leptera is a phenomenal supplement for, it's a meal replacement. This helps to reestablish good bacteria, as well as it's good amino acids, all the vitamins and minerals, digestive enzymes, and good bacteria. And that's Leptera. And then the balancing endocrine system, the hypothalamic, the pituitary, the adrenax, and the thyroid. And then I would have over here as well the Zenadapt. And then many times down on this side over here, I would be thinking about Femifirm and PM Sync for those that have depression around their cycle. So I'm just adding this in. I didn't put it into the PowerPoint, but Femifirm supports the female cycle, supports the endocrine system, or the endometrium and the uterus and ovaries during the build-up phase of the cycle. So this would be given from day 4 to day 20 of the cycle. The day 1 would be the first day of menstruation. So Femifirm is day 4 to day 20, and PM Sync, or for PMS symptoms, to synchronize them, diminish them, is taken from day 21 through day 3. The other one you could also think about is Manafirm, and Manafirm helps or the male function, erectile dysfunction, low testosterone, just low energy, low constitution. So that's Manafirm, and that would also be beneficial. So this is what I have for you tonight on the depression. I hope this has been beneficial for you. So what Inno-Vita products that can help with this is CalComp, because it has D2, has 6,400 international units, or 1,600% of the vitamin D, and that of the US RDA. So this is the largest in the Inno-Vita products with the vitamin D is CalComp. So, and that's also got the calcium, and that would be very effective at supporting and increasing your vitamin D. Also, C-Comp has D2, and that has 3,200 international units, or about 800% of the US RDA. So those two together would give you enough, and they're suggesting about 10,000 IU, international units per day, that would help with SAD, or seasonal affective disorder. So that's a great question. So in the system, within Inno-Vita, vitamin D2, or is called ergocalciferol, is derived from plants, which is so important. Vitamin D3, this is cholecalciferol, is derived from animals. So everything within Inno-Vita, it's all done around plant-based. So that's what's so important. So the D2 is much more effective, and that's what's in the CalComp and C-Comp. So C is vitamin C, the C-Comp is vitamin C, and the CalComp is for calcium.